The TREAT trial was a very important initiative that was coordinated by investigators basically in Brazil, and I should mention here the trial chair, Dr. Otávio Berwanger, is a friend of mine, who did an amazing job in conducting this trial and leading this trial from Brazil, initially at HCOR Institute. And I was happy to and privileged to work with him on the trial as part of the steering committee, as well as the CEC, the Clinical Event Classification Chair of the study. And basically, TREAT wanted to answer an important question was, can we use Ticragelor, which is a more potent antiplatelet agent, in patients who actually had or presented an ST elevation myocardial infarction, but that was treated with fibrinolytic therapy. So we know that Ticragelor has been shown to be superior to clopidogrel in patients with ST elevation myocardial infarction, non-ST elevation myocardial infarction, but patients who actually were treated initially as with thrombolysis were excluded from those key trials. So we had that gap. The TREAT trial enrolled about 3,800 patients in 10 countries and included patients below 75 years of age who presented with an ST elevation myocardial infarction and who got treated with thrombolytic therapy. And then we compare the use of Ticragelor versus clopidogrel. And the main results were already presented a year ago, which was the 30-day outcomes in terms of bleeding, because we were really worried about how safe it is to use a more potent P2Y12 inhibitor after thrombolysis. If we have to give in a patient who just got thrombolysis and therefore are at high risk for having a bleeding event, we need to be cautious in using an antiplatelet that is more potent, because you can potentialize and maximize bleeds. And we showed at that time, a year ago, that the rates of bleedings were comparable between clopidogrel and Ticragelor. And now at ACC this year, we basically are reporting the 12 months follow-up, particularly looking at ischemic endpoints, death, recurrent MI, stroke, vascular deaths, to see if there was any difference in the endpoint that we called ischemic endpoints. And also, of course, look at the bleeding to see if there is any other difference in bleeding, although we were more worried about bleeding in the more short-term phase, the first 30 days. And now we are also interested to look at the ischemic endpoints at 12 months. And basically what the trial showed is that there was no significant difference between Ticragelor and clopidogrel for the ischemic endpoints at 12 months. And we also look at bleeding at 12 months, and the rates were still very low, about 1% in each group, and no significant difference between clopidogrel and Ticragelor. We now extended, showing that the safety is preserved up to 12 months, and we didn't find any signal of difference in ischemic events between the two treatment arms. Ticragelor has been so extensively demonstrated to be safe and efficacious now that I think this additional piece of information is really reassuring about the safety, particularly in the first 30 days for patients who got treated with thrombolysis. So I think TREAT gives the additional reinforcement that it's reasonable to use Ticragelor also in patients who presented with a STEMI and who are also treated with thrombolysis. Particularly if you wait 12, 24 hours and then you start Ticragelor, we show that this is reasonably safe and it does not compromise the efficacy of Ticragelor.